Press record.
We are Group 5, and today we will be presenting the effects of smoking on plastic surgery patients. My name is Kayla Pettaway, and I will be explaining plastic surgery versus cosmetic surgery. In any other situation, it is important to note that there is a difference between plastic surgery and cosmetic surgery. Cosmetic surgery is focused on enhancing your appearance. In contrast, plastic surgery is focused on repairing any defects to reconstruct a normal function and appearance. Although they are different, we can acknowledge that both are used to change a person's appearance, so we will use the term interchangeable for the presentation. To reiterate, cosmetic plastic surgery is done to change your appearance that can bring lasting and dramatic changes to the outside appearance to both men and women. So what are the most common procedures? The most common plastic surgery procedures are as follows: breast augmentation, breast implant removal, breast lift, buttock lift, and chin, cheek, or jaw reshaping. All surgeries carry an added risk if you already have pre-existing conditions such as cardiovascular disease, diabetes, or obesity. You run the risk added complications before, after, and during your surgery. Common risks associated with plastic surgery include complications related to anesthesia like pneumonia, blood clots, and death, which is considered more of a rarity. Other risks are infection at the incision site, fluid buildup under the skin, mild bleeding, and obvious scarring or skin breakdown. After surgery, normally you can expect temporary bruising and swelling. The surgical scars, for the most part, are permanent but can reduce visibility over time. Recovery time runs differently from person to person, but a common time window is from 6 to 12 weeks for many procedures. If the patient smokes, it is an added risk on top of the risk previously mentioned. It is important to note that plastic surgeons can deny proceeding with surgery on the basis that it is a danger for the patient to receive surgery. Health-wise, it is recommended that no one smokes, not just for plastic surgery patients, but also for heightened risks of other health concerns such as cancer, heart disease, stroke, lung disease, and more. Risks are loss of cheek skin, nipples, or tummy skin after a facelift, breast lift, reduction, or tummy tuck surgery, as well as infections, death of fat cells, delayed wound healing, thick white scars, blood clots, and loss of implants. For example, a patient who smokes or consumes nicotine in any form and undergoes a breast augmentation or breast reduction procedure is at risk of experiencing tissue death, which can result in the nipples discoloring before falling off. A facelift could result in the loss of cheek skin, and the same applies for tummy skin with a tummy tuck. This sort this my bad. This sort of disastrous outcome is termed tissue necrosis in the medical world, and I'm sure it's something all smokers will be very keen to avoid when undergoing any plastic surgery procedure.
Hello, my name is Michelle Davila, and I will present the second half of the project. You may be asking how and why. It is important to know that we are specifically talking about the source of the issue. nicotine. This includes cigarettes, cigar alternatives. This also includes patches, gum, snuff, pipes, vaping, and secondhand smoke. Nicotine and carbon monoxide are both present in cigarettes. They can decrease oxygen levels and greatly increase risk of heart-related complications after surgery. Smoking tobacco also damages the lungs, making it difficult for the proper amount of air to flow through, increasing the risk of post-surgical complication to the lungs. Smoking distorts a patient's immune system and can delay healing, increasing the risk of infection at the wound site. Smoking just one cigarette decreases the body's ability to deliver the necessary nutrients for healing after a surgery. In regard to surgery, when should someone quit? Patients should be tobacco-free 4 weeks before and after, but it is better if you quit earlier. Some doctors recommend 6 weeks. If you must, you should wait till you have completely healed, which should take 6 to 12 weeks or more depending on the patient and the surgery. Every tobacco-free week after 4 weeks improves health outcomes by 19%. This is due to improved blood flow throughout the body to essential organs. Smokers who wait approximately 4 weeks or more before surgery have a lower risk of complications and better results after 6 months. Smoking, surgery, and the body systems. Cardiovascular system. Cardiovascular function, chemical substances contained in tobacco increases the body's need for oxygen, but reduces its capacity to use oxygen. Nicotine stimulates the central nervous system, increasing blood pressure, heart rate, peripheral vascular resistance, and oxygen consumption. Nicotine is also thought to induce vasoconstriction and inhibit platelet aggregation, reducing oxygen transport. Carbon monoxide reduces the availability of oxygen for cellular processes by binding to hemoglobin and also inactivates cardiac enzymes, leading to decreased oxygen transport. Together, these results in tissue hypoxia and increased blood viscosity, which increases an individual's risk of heart attack or stroke. Respiratory system. Smoking has an adverse impact on pulmonary function, primarily through decreased mucociliary clearance and abnormal small airway function. Cigarette smoking damages the ciliated epithelium and the tracheobronchial tree in the lungs, leading to increased mucus, obstruction in the bronchioles, and reduced ciliary function, and increase the risk of infections and respiratory complications. Mucus hypersecretion may result in deterioration in the oxygen transport system, inflammation of the airway, and decreased pulmonary complications. Integumentary system. Smoking may impair surgical site healing and promote wounds opening along sutures via a number of pathways. This includes peripheral tissue hypoxia leading to necrosis, decreased inflammatory responses, and delayed proliferative healing responses and reduced collagen synthesis. Increased oxidative stress slows down the wound healing process and reduces the body's capacity to fight bacterial infections. Smoking also impairs anti-inflammatory cytokines responsible for regulating the immune function within the body. The skeletal system. Smoking may also impair bone healing in several ways, including increased tissue hypoxia, vasoconstriction secondary to nicotine, and direct impairment of osteoblast activity and collagen synthesis by tobacco smoke. Smoking is classified as a top 10 risk factors for non-union of long bones. In conclusion, smoking should be avoided before and after any surgery. All of these complications are difficult for both the patient and the surgeon, which is why most plastic surgeons will require a patient to quit smoking prior to surgery. Although recommended to quit smoking completely, it is still an option to continue once the healing process is finished. It is important to avoid secondhand smoke and to consider your options before any surgery. It is important to note that one should be honest with their doctor when seeking these types of procedures for the safety of oneself.